Namaskar. We would like to welcome you all on behalf of Independent Research Ethics Society, AYUSH Samriddhi International Webinar Series at milestone of 2543 in 5 years and 907 in recent 365 days. Thank you. Thank you very much for your overwhelming support, active participation, mentorship, guidance, cooperation, whatever not. So I'm really grateful to all speakers, all participants, and our pillars. Two pillars are already there, Dineshwar sir and Harish ji. Welcome, welcome all. So today's speaker is anovulation and infertility Ayurveda intervention. And we are really grateful to Dr. Soumya ji, Assistant Professor, Department of Prasuti Tantra and Stri Rog, Sri Kalbhairaveshwara Swami Medical College, Hospital and Research Center, Vijayanagar, Bengaluru. Welcome, madam. Welcome by heart. Kamini ji will also join these two series on every Thursday, Infertility series, and on every Saturday, Woman Wellness series are inspired by Professor Kamini Dhimanji. Professor Kamini Dhiman has coordinated well from last 1.5 years, and this series is developing its brand image, growing due to your overwhelming support. So thank you, Soumya ji, again. I would like to welcome you on the platform. Please do join every day whenever you have time, because topics are very relevant, crucial, critical, and beneficial for the society. So thank you again. I would like to invite you for your valuable presentation and blessings to the society, because you young teachers are really inspiring. And before, when we did our MD, orators were very less. Now, oh, excellent. Salute to you all. Salute to you all. So, Dr. Soumya, without wasting much time, I would like to invite Dr. Soumya ji from Bangalore. Dr. Soumya ji, welcome. Deepika ji is with us. Welcome, Dr. Soumya.
Shall I share the screen, sir? PPT?
No, you can share.
It is seen, sir?
Yes, you can go for slideshow. Slideshow to maximize the screen. Yes.
Now it is seen, sir?
Great, great. Please go ahead. Welcome.
Yes, sir. Thank you, sir. Thank you so much. Firstly, I want to tell one small shloka to the one who has been everyone participating in this and who is patiently listening to my presentation today. A small shloka. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Parabrahma, Tasmai Shri Guruve Namaha. As I wanted to tell this shloka, I'm the very youngest one where with 5 years of experience in my academic year as well as with a practical experience. Our hospital is of both a college connected with a running hospital. So I welcome you all for this presentation, and I wholeheartedly am very grateful to my guide, Dr. Gayatri Bhatt MD. Madam is professor and HOD of the Department PTSR in the College of STM, College of Ayurveda, Hassan. And I wholeheartedly even grateful to the Dr. Kamini Dhiman Madam, former professor and HOD, Department of Prasuti Tantra and Stri Roga, All India Institute of Ayurveda, New Delhi. And I wholeheartedly even grateful to Dr. Pawan K.R. Sharma sir, professor at HOD RSBK, vice president, as well as the director of Med Pharma. I'm very thankful to you, sir, for giving me an opportunity to present a topic related to anovulation and infertility. And I even wholeheartedly, I'm grateful to our beloved principal, sir, Dr. Kiranam Gaud, sir, as giving me an permission as well as to attend in this AYUSH Samriddhi International Conference Series. I'm wholeheartedly even grateful to our principal, sir, of our college. Sir, I'm audible, sir? Sir?
You are clearly audible, madam.
Yes, sir. Shall I continue, sir? Okay, sir. Yes. Today I will be presenting on the topic management protocols for infertility with special reference to anovulation. It's a case series. So myself, Dr. Soumya Ji, Assistant Professor in the Department of Prasuti Tantra and Stri Roga from the College Sri Kalabereshwara Swami Ayurvedic Medical College, Hospital and Research Center, Vijayanagar, Bangalore. So let me move on with the introduction of the infertility. Of course, everyone will be knowing the definition of infertility. It is inability to conceive within 1 or more years of regular unprotected coital activity. So there are the types. One is of primary and another is secondary infertility. Denotes those patients who have never conceived. It is considered as primary. The secondary infertility, already having a pregnancy, already having a history of the children or the previous pregnancy or the abortions, it could be considered a secondary infertility when there is a failure to conceive subsequently. So there is a global prevalence around 17.5% of the adults worldwide experience infertility according to WHO. So moving upon with the next slide, incidence. So basically we consider infertility not only for female, it could be related to female as well as a male infertility and the combined factor. So combined factor, it is of 30% of incidence rate in case of infertility, combined factor of infertility. And in case of female factor, it is the 50% of incidence rate. And in case of male factor, it is the 20%. So moving upon with the female infertility causes. So we come across with a n number of causes, that is, it could be related to a low AMH level, or it is of ovarian factors, or it is of uterine factors. Uterine factors could be anything. It might not only related to endometriosis, it could also be related to adenomyosis or the fibroids or the polyps or the endometrial cyst. Even it could be related to cervical cancer as well as with a even related to fallopian tube salpingitis or any tubal block could also be a reason related to it, or any kind of PID infections. So even with related with the male infertility, it is related to hormonal, or it could also be related to anything anatomical dysfunctioning is there. So this could be a one thing where it could be ruled out in case of male infertility causes. So my topic is related to anovulation and infertility. So let me move on with a main causes related to female infertility. So as I said, it has been related to a female reproductive system. It might be a ovaries, or it could be a pathology related to fallopian tubes, or to the uterine cavity, or even with the cervix, or even with the vaginal canal. So basically, the causes could be anything. So here I have put upon with the 6 main causes where we can come across in cases of infertility, especially with respect to female infertility. So the first and foremost I have said regarding the unexplained infertility. So nowadays we get the cases of unexplained infertility also, and even the more of blocked fallopian tubes, and of individuals with any kind of genetic disorders or the chromosomal disorders, if any detected, can also cause a female infertility. Of course, nowadays we would have seen a woman chase of more educated, she need to build a career life. So after building a career life, then she look into a marital life. So after 30s or after 35, they get married. Then they fall into a situation where they have to face infertility complaints. So this could be seen even in the age group of age above 30 or even with the age of 36 years. So here it mainly I concentrate upon the ovulation. That is, related to ovulation disorders. So today my presentation starts with anovulation, that is leading to an infertility in female. So moving upon with a very important factor, that is Garbha Sangraha Samagri. So Garbha Sangraha Samagri, it is the common thing where we'll be read when we are in UG, as well as when we come to a post-graduation. Even when we start practicing also, we analyze these 4 factors. So that is Garbha Sangraha Samagri. So the first and foremost thing, it is related to Ritu. The second thing is the Kshetra. The third very thing, it is the Bija, and the last one is Ambu. Ritu, Kshetra, Ambu, Bija. Where here, Ritu, it's not only where you have to take it as the ovulation period. Yes, of course, I do agree, ovulation period we have to consider. But here, when we are in the concept of anovulation, so when it has been related exactly to an ovary, there you have to even consider related to hormones, as well as we have to consider related to the cycle. That the menstrual cycle regularity we have to see. The regular cycles, it is of 28 to 30 day of cycles when we are considering. So then the first period it will be of menstrual. So then the next period it will be of follicular phase. Then on the 10th day up to the 18th day of an menstrual cycle, it will be of ovulatory period. Then it starts with a secretory period. So the ovulatory period, what we are taking, starting from a follicular phase till the day of ovulation, so we can consider it as the Ritu. So when we are considering it is of Ritu Chakra, it is of complete menstrual cycle. So moving upon with the next Garbha Sangraha Samagri, that is the Kshetra. Kshetra also is very important, as when there is a ovulation is happening, so the chances of fertilization is there. Once the embryo is being formed, that has to be get implanted within the uterine cavity. That is the Sthiratva of the Garbha has to take place in the Kshetra, that is the Garbhashaya. So that's is also a very important thing next following the Ritu, next following an ovulation. So here the next is the Ambu. Ambu, what we are considering here is the nourishment. What we are telling, it is the development further after Ritu. When we come to the Kshetra, that is the Ambu. So here the Bija is the overall, we can consider it as the Artava, we can also consider as Pushpa, we can also consider as the complete Bija here, where we can also understand the Shuddha Artava Lakshanas also can be considered here. As the Bija, Anta Pushpa also we can consider, and Bahi Pushpa can also be understood in the factor of Bija. So Anta Pushpa, where we can consider it as the Bija Utpatti, that is the ovulation we can consider, and the mature ovum we can consider. And when we consider as of the Bahir Pushpa, it is the Artava, that is the Shuddha Artava. So when there is a Shuddha Artava formation is there, so when there is a proper Ritu Chakra is there, so there are the very chances of release of the mature ovum from the ovary. And when the mature ovum is being released, or it is being coming out from the ovary, and the chances of having the more fertilization, that is having the conception rate is high. So I am taking the concept of Bija, where it is of anovulation, the condition which is being one of the main important cause for female infertility. So now let me move on with a case series with special reference to anovulation. I think you will be able to see this picture. So here it is showing with a small circles and along with the red color marked within the circles. So the small circles have been filled with a red color. So this shows that where the ovulation has been occurring. See, why I have put this picture is, see, in the text, it is clearly given with the regular cycle of 28 day or 30 day of cycle. So the ovulation usually it occurs at the day of 14th or 16th day. So it starts with the day 10th, 11th, 12th, 13th, 14th. So exactly on the 14th or the 16th day, it is a ovulation period. This is what we understand. So this is regarding the concept of ovulation. So this is I have marked. It is telling a picture tells regarding the appropriate date of ovulation period. So and another information what I want to convey is that as I seen in case of infertility patients, especially in related with the pathology of ovaries with respect to that of anovulation, their ovulation usually doesn't exactly occur within the 10th or the 14th or the 16th day of menstruation. It is the chances, even I have seen After 20th day also they ovulate, or even at the day of 23rd or the 22nd, even at the exact the 1 month of cycle, they do ovulate. So keeping this concept in mind, I have shown in a picture telling that the ovulation marking is very important. It tells regarding, it is the most of the cases where I have been observed that it is a delayed ovulation. It is of delayed ovulation. It's happening. It's because of that delayed menstruation. So because of delayed menstruation, there is a delayed ovulation has been occurring in an woman. So that's why I have given an quotation regarding this. Anovulation is what every woman should know about the ovum release and the pregnancy. I repeat once again, anovulation is what every woman should know about ovum release and pregnancy. Because most of the time, the patient tells the couples when they come to the OPD, they tell that we are trying for many years. We tried even the last 6 months. Still, I am not able to conceive. This is the common thing, the common complaints that are being said by a couple. They are trying for many years, they are trying for many months, but still I am not able to conceive. It's the thing, anything that has been related to me, that is the pathology, or it could be related to a disorder there. So then we need to educate them regarding their menstrual cycle, regarding their follicular phase, and regarding their ovulation period. It might be a delayed ovulation or it might be an early ovulation. So regarding this ovulation period, the knowledge is very important for women who is being having a trying for a pregnancy, or for the one who is trying for a conception. They should know the knowledge of the ovulation period, whether it is delayed or the early ovulation has been happening. So now let me move on with the next slide. So now let me tell regarding the each cases one by one. So I have taken now 4 cases. So these cases are diagnosed a female of different age groups of varied chronicity in Bahudosha Avastha, approaching the OPD of our college, Sri Kalabereshwar Ayurveda Medical College, Hospital and Research Center, Vijayanagar, Bangalore, to the OPD of Prasuti Tantra and Sri Roga. So let me tell about the case 1. Case 1, the patient age 31 years. She is anxious to conceive, married life of 5 years, and she is having the even complaints of irregular cycles since a married life of 5 years. And she is also a known case of PCOS, polycystic ovarian syndrome. The case is present. The patient, when she came to OPD, she presented the complaints as it is, telling that 5 years of married life, even with irregular cycles, and the known case of PCOS. And along with that, she also gave a particular history telling that she is having the recurrent urinary tract infections since 3 years. So recurrent urinary tract infection since 3 years, it shows that I even asked regarding this, are you a working woman or the housewife? She said that she is working in IT company. She is a software engineer. Whenever she uses a public washrooms, she will have immediately she'll have an infections, and she'll suffer with an urinary tract infection, and it will be lasting for a week, or it will be lasting for even 15 days. After taking the medications regarding that, these complaints will be minimized. This is what the history given by the patient. And along with that, she also had an history of failed allopathic line of management. So failed allopathic line of management is that priorly coming to our hospital, she had already visited n number of other modern hospitals, and she had got no proper result in that. They have to give medicines. She used to take the tablets as well as the injectables, but there was no improvement in their egg release or with the follicle development, but landing up with one or the other issues of an menstrual irregularity. After taking the medicines, she was used to have a regular cycle for 1 or 2 months. Again, the same thing would be continued with the absence of menstruation. This was the clear cut of complaints of a first case, and it was diagnosed as a primary infertility. So moving upon with the second case, where here the patient is aged of 25 years, and she is also anxious to conceive, and she is of married life of 3 years. And this is the one patient I have seen. She has not taken any kind of allopathic medicines, even for her regularizing her cycles, or even to have conception, to conceive also, she has not taken any kind of allopathic medicines in the fear of having any kind of side effects. This is what the patient said to me when she first consulted in our OPD. So then, and she started telling that she wants to first regularize her cycle, then she need to conceive. This is what her mindset telling to us. First, she has to have regularized in her cycle, then she has to move on with the conception. And she's the first patient what I'm seeing, that she's the one telling that she doesn't want any kind of allopathic line of management. Only the thing that she wants full of Ayurveda, and it has to be no side effects. This is what the patient said in a first visit in our OPD. Moving upon the case 3. Case 3, age 30 years, anxious to conceive, married life of 7 years, but it is a clear-cut case, shows that the multiple cyst in an ovary and the very big size of ovarian cyst was also seen in this case report. And it also been said by a patient, she is also suffering with an ovarian cyst, and even a number of medical management with the modern line of treatment she has been taken, but not got a relief from this, or not got a proper result out of this. This is what the patient history as well as the complaints when she visited to our OPD. So moving upon with the case 4, it is of age 31 years, anxious to conceive, married life of 4.5 years. So this is the case what I observed in the 4th case. It is also a irregularity in cycle. Menstrual irregularity was there since menarche. And this patient attended a menarche at the age of 12 years. Since 12 years till the age of 31 years, she is having her cycles irregular. It means it's not the thing that 28 days she gets a cycle. It varies. Sometimes it is of 45 days of cycle. Sometimes even 2 to 3 months she won't be having a cycle. So once she gets a cycle, then it will be of heavy flow for more than 10 days or the 15 days. This was the history given by this patient. And along with that, she's having a very huge medical history, where it tells that she had underwent with a laparoscopic ovarian draining in 2024 last year. And she also had same polyp within the endometrium, where it has been operated altogether during a laparoscopic surgery. And as such, all these interventions she underwent because to go treatment for infertility, to have a conception. So she underwent all these laparoscopic surgeries so that her cycle gets regularized, and then she can move on to have a conception. This was the history given when she's been visited to us. So when even she also tells, so n number of medications also taken for an conception, but all the medications doesn't give any kind of proper result in that. Whenever it has been gone for an scanning, for especially for an follicular report, it never showed an dominant follicle at all. Always it is a very no significant growth in the follicle was seen. This was her main complaints, and even with the couple. So both the husband and the wife had a very stress about these complaints, especially of irregularity of cycle, and underwent a laparoscopic surgery. And but still there is no regularity in cycle even after laparoscopic, and even after laparoscopic there is no significant growth in the follicles. So all these cases of case 1, case 2, case 3, and case 4, it has been completely related with a primary infertility. So I have taken with the primary infertility. And one thing I need to tell is that all these cases, once also they have not conceived, or even their cycles has not delayed, or even they have not having a history of miscarriage. So all 4 cases of same thing related to primary infertility. Only the thing is there are variations in their medical history, as well as the age, as well as their married life history, and along with their associated complaints. Sir, hello, sir. Hello. Sir, are you able to hear me?
Yes, Soumya, yes, continue.
Yes, ma'am, yes, ma'am. So now let me move on with the Nidanas. So here, what the Nidana I have found in all the like 4 cases what I've said till now, the Nidana is related to their Hahara, the Vihara also, sedentary lifestyle is also there, and not of much of any chromosomal abnormalities till now. Because all of the cases have got a good result. In the further slides, I discuss it in later. And moving upon with this, the main factor what I see in these all 4 patients is related to Manasika Avastha. So Manasika Avastha, it is of more of related to the social as well as even with the personal behavior. So the case 2, what I said, the age 25 years, just a married life of 3 years, she was so upset, she was so anxious as well as so depressed. She has told me her even little bit of family history, telling that her co-sister has been conceived second pregnancy. So, and her mother-in-law is telling that she even till now with a married life of 3 years not conceived. This was her main complaint. Again and again when she come for a follow-up, right? This was the main complaints of the patient. So this was the main thing where I could assess in a case 2, that is the stress, the anxiety, and the depression level. I do agree with the first case, the third case, and the fourth case. They do also have the more of anxiety regarding this issue of infertility. So moving upon with the Samprapti Gataka. Here, the Samprapti Gataka, what the doshas have been analyzed as the Vata Kapha Dushti. Dushya is the Rasa Rakta Mamsa Meda Asti and Artava Dusha. And Agni is the Jataragni Vaishamyata and Datvagni Vaishamyata level is also have seen. That is the Samprapti Gatakas. And the Shrotas mainly here it are Artava Shrotas. Artava is the Upadhatu of Rasadata, Rasava Shrotas. Involvement is there, and as well as the Veduvaha Shrotas and Astivaha Shrotas. So once again, I come back to the previous slide here where I wanted to tell the very important thing, that is of case 4. So case 4, as it is of laparoscopic ovarian drilling is being done, here the patient was expecting the more thing, that is telling even after the n number of surgeries have been underwent, why the cycle has been not regular. This was her first question. And very important thing that even my age is also of 31 years, it's still more I write whether I may conceive or not. So all these history part it tells regarding the involvement of Manasika Avastha of a female, that is the stress level of a female here. So then I move on with the next slide, that is of Samprapti. So here, Samprapti, where I need to tell the one by one. So where what dushti it has been happening here, and in which part where it has been analyzed as in pathogenesis, that is the Samprapti. So Kapha Vata dushti, Kapha has the mala of Rasadhatu, vitiates and does the Avarna of Vata, and Manasika Nidana directly vitiates the Rasa Dhatu. It is taken from the Charakas reference. So Meda Dhatu dushti, the Meduvaha Shrota dushti, due to the Kapha Avrita Vata leads to Staulya. Asti Dhatu, Dushti, Kesha and Loma are the mala of Hasti Dhatu. Hirsutism and the male pattern of baldness or the hair fall are also seen in the patient. So in the case of the second case as well as in the first case have even heard the symptoms telling that there is a weight gain, and also the hirsutism, the facial hairs was also observed in the case 1 and the case 2 patients. So then moving upon with the Shukra Dhatu Dushti, there is a disturbance in the male sex hormone levels, excess of androgen and the testosterone. So Arthavakshaya Lakshanas, that is Etochitakala, Adarshanam, Alpata and Yoni Vedana. So all these symptoms of irregular menstruation, even if the cycles occur, it is not the proper flow of 3 to 5 days. It is will be of scanty menstruation will be there, that is oligoamenorrhea, that is Alpata, and there is also complaints of Yoni Vedana, that is the painful menstruation is also present. So here it is the clear cut of Arthavakshaya Lakshana, where there is a Etochidakala, that is of irregularity in the cycles, and as well as with the Alpata, there is a less menstrual flow discharge is there, and also of Yoni Vedana. So here moving upon with these Nidanas, because of these Nidana Sevanas, where it is mainly impairing the Agni, that is of digestive factors, mainly of Agni Dushti, as well as there is leading to an Rasa Dushti, where the Rasa Dushti, where further it will be leading to the Dushti of Upadhatu, that is the Artava. So Artava is mainly the Upadhatu of Rasadhatu. As the Rasadhushti is taking place, it's because of Agnimadhyata. There will be a Rasadhushti, and the Rasadhushti where it will be leading to a Artavadhushti, where more of Artava Strota Sangha, and that will be leading to Artava Kshaya. So once there is an Uttara Dhatu Dhushti as well as the Dhatvangi Dhushti is there, that will be hampering even on the Artava Strotas and leading to an Artava Stroto Sangha and of Artava Kshaya. So this is what I have been analyzed as an pathogenesis and the samprapti in the cases of infertility with special reference to an ovulation. So now I move on with the next slide, that is management protocols that are being followed in these cases. I think you will be able to see the picture. See, the first and foremost I have been put upon with the Shamana Chikitsa as well as with the Shodhana Chikitsa. Both I have been put, Shodhana as well as the Shamana Chikitsa. As the patient, when they come, right, they will be giving an history, especially they tell that there is no cycles for 2 months, no cycles for 1.5 months, or it is of irregularity. So I plan for a Shodhana. So I plan for Shodhana in such a manner that it has to first they have to undergo with their cycles. At least 3 or 5 days they have to get a cycle. So after completion of cycle, let me move on with the Shodhana Chikitsa. So sometimes even though I wait for 1 month, 2 months to have a natural cycle to happen, or even with induced with an Ayurvedic line of management with our formulation, still sometimes the patient won't get cycle. Then I move on directly with a Shodhana Chikitsa. Prior to that, I move on with a Udvartana, then followed by Svedana, then followed by Sneha, then Snehana, then I follow with a main line of Panchakarma treatment, that is the Shodhana Chikitsa. So the picture it tells regarding the Shamana Chikitsa, then the Shodhana Chikitsa. So the next thing what you can observe, the next line of pictures is that it tells regarding the Panchashodhanas, that is the Vamana, Vireshana, Basti, Nasya, and the Raktamokshana. And even you could have also seen the Basti, that is the Uttara Basti. Even in these cases of primary infertility, what I have been treated, not only with the Panchashodhanas, even with our specialized line of management, that is Uttara Basti, also have been advised, also have been treated in these patients. So then the next picture, what you see, it's regarding the asanas and the pranayama and the yoga. You are seeing these pictures. Even along with the Shamana Chikitsa, along with the Shodhana Chikitsa, along with the line of specialized line of management, that is the Uttara Basti, even I have been advised the patients to do yoga daily and to normalize both the body and the mind. So I have been advised to do.
Please unmute. Please unmute.
Audible, sir?
Yes, yes.
Yes. So whether I'm fast or should I do slowly, sir? Shall I continue, sir?
Yes, yes.
Yes. So the second line of management where you can see regarding the formulations. So what formulations we are advising, whether it is of the formulations regarding to the kashayas or the gutikas, or it could also be a gruta. So these second line of picture, it tells regarding the starting of and formulations have been described with the first picture. Then I have been described with the next, it is of diet, what the patyas that has been followed to the patient to have a conception, to have a healthy conception and to have an healthy progeny there and to have a ovulation properly. So this picture, it is completely, it has been related to and management what I have been following to an patient. So one is regarding the Shodhana Chikitsa, followed by Shamana Chikitsa. It's also been followed by the Yoga Asanas Pranayama, then the related with the Ayurvedic formulations, then also related with the what the patya that has to be followed to have an proper ovulation and to have an healthy conception and then healthy progeny. So I move on with the next slide. So now let me discuss with each cases here. So case 1, where I have been followed first with the Chodhana Karma here as the patient. So first here, just in a gist form, I'll be telling case 1, case 2, case 3 and the case 4 what I have done here. So in the further slides, I'll be showing in each day or the dates have been mentioned what it has been followed. So in first case, only the two procedures have been advised to a patient here. One is regarding the Vamana Karma and another one is the Virechana Karma here. So prior to the Vamana as well as have been followed the Udvartana, the Svedana and the Snehana Karma, then the followed by Vamana and again in the next followed by Virechana Karma, and also with the oral medications of Phalagrita have been addressed. Only the simple line of management have been started within a case of case 1. So then moving upon with the case 2, here the still more better way have been improved in the case 2 because she is having more of pathology that is related to her cycles as well as related to her ovulation. So moving upon here in case of case 2, it is of Vamana Karma. Then here have been also followed the Yoga Basti also and also the Uttara Basti for 3 cycles have been followed and the more of oral medications have been prescribed in this case 2. It is of Sri Vyadihara Rasa I have given, Pushpadanva Rasa as of course even the Phalasarthi even have been advised even in the case 2. And extra what I wanted to inform regarding the case 2 is that I have been performed the IUI procedure, that is intrauterine insemination procedure is also done to this patient in the case of case 2. So then moving upon with the case 3. So in the case 3 here the same of Pramataha Shodhana is being done and followed by Uttara Basti for 2 to 3 cycles, consecutive cycles is being done. And along with that, here I have put upon with the extra 2 medications of the tablet leptidine and the hallose compound has been advised, followed by Phalasarthi, Sri Vyadihara Rasa, medication and Chitrakadipati. Here also in this case where it has been followed with an IUI procedure, actually I have done this procedure this month on 5th of this month it has been conducted and it has been awaited for the results. So then moving upon with the case 4. So the case 4 was a bit complicated with a laparoscopic surgery history of 1 year back. So here what I planned is regarding for every of the patients have been followed with a Vamana procedure as keeping in the mind there is Vatavrita Kapha is there and it is of Artavakshaya condition is being Artavakshaya disorder is being present. So keeping that in mind where more of Kapha as well as the Vata Dusti of Vatavana Kapha Dusti is there. So I am moving upon with the procedure of Vamana Karma and the same here I have been followed with the Uttara Basti for the 3 consecutive cycles and followed with the continuous intake of oral medications, that is Ayurvedic line of management only is being followed. And here in this case I have not done a IUI procedure, it has been conceived naturally. This case 4 is conceived naturally and she is regularly coming for an ANC checkup, antenatal care checkup she is coming and now she is running up within gestational weeks of 8 weeks she is running, that is 2 months of gestation she has been running. And in case of case 1 the patient conceived naturally and she delivered female baby also. And in case 2 under IUI procedure after the Shodhana, after the oral medications she conceived an IUI procedure and she delivered male baby in the month of June, last month only she has been delivered. The third case where it is being awaited for the result. So now I move on with the next slide, Chikitsa Siddhanta. So Chikitsa Siddhanta as I go through now. So it is of regarding Tatra Samshodhanam Agneyanam Cha Dravyanam Vidhi Upayogaha. So here what I follow is of full of samhitas, what the acharyas have been mentioned for the particular disorder of Vandyatva and even in the particular disorder of Bija Dusti, it is of Shodhana Karma, then the followed by Agneya Dravyas. So here why I have chosen the same line of management as it is the same the patient has an typical features of complaints of Bija Dusti and the typical features of having the complaints of irregular cycles. Few of the patients having the irregular cycles since 5 years, even since 6 years or even with the 6 months they are having. And one of the patients of case 4, she is having the irregular cycle since menarche. So looking into the case study of the patients, so I have been following the Chikitsa Siddhanta The second one, that is Alpa Pushpam, Nasta Pushpam, Nasta Bija, Karbanya Bija, Parita Raktascha, Shukra Dosha Vyapanna, Yoshito Anu Vasaha. So here, as in the case of Alpa Pushpa, Nasta Pushpa, and Nasta Bija, that is of Alpata in the Pushpa formation, that is of oligoamenorrhea could be taken, even the oligo ovulation, or it could have irregular or amenorrhea, even of complete absence of ovulation, where it is being said to go for the Anuvasana Basti. So here, as an Anuvasana Basti, even I have been also followed the Basti Karma line of treatment, as well as the line of Matra Basti is also being followed here. So the next sloka, it is Snehanam Svedanam Vamanam Virechana Astapanam Anuvasanai Kramashaha Upacharet. It is the Kramashaha Upacharet means the Kramataha, that is one by one the Panchakarma line of treatment has to be followed. The same thing I have been followed as Snehana Karma, Svedana, Vamana, and the Virechana line of treatment followed by Astapana and Anuvasana. And the last, it is been telling regarding Upacharet Madhura Aushadhi Siddhabhyam. Yes, of course, I have been put upon with the Phalasarpi and always with the Rasayana line of management to rejuvenate the cells and also to have the pushti of an bija here and to also to regularize the cycle and to have an healthy ovulation, that is the mature ovum to release. So this is all about related to the Shodhana Karma and always and also with the Basti line of management. Even the Kashyapa Acharya said that it is of Basti is being considered as an Amruta, that is of Ardha Chikitsa, but it is being said by our Acharyas also. It is of Ardha Chikitsa for any kind of disorders. So when it is being related to infertility, especially it is of the Vata Dushti, that is of Apanavayu Dushti is there. For the Apanavayu Dushti, it is of Basti line of management. It is the best line of treating a condition of Vandyatva. So for Basti, when it has been an infertility condition, Vandyatva condition, the Basti line of treatment is a best line of treatment to have an improvement in a fertility rate. So now let me move on with the next slide. So now here I move on with the stepwise. That is on which date it has been started. So how long the treatment has taken and what was the treatment followed by the previous one. So here the couples visited in the month of August 2020. So one thing I wanted to tell. So I joined the college in the year of 2019, December 30th. So this was my first case where I got into an infertility patient to treat, and within the 1 year of period, this patient got conceived, and I was so happy that even I got a little bit of confidence in treating the infertility patient. This was my first case, so I still remember the patient, the way she approached me, and what she had a history as well as with the complaints. Even with the full reports I have, and I have been also put into the slide. So in the further slides, I show all the reports of this case one. So, so this was the case where she visited in the year of 2020 in the August month. She had a complaint where she didn't have a cycles for 2 to 3 months. So then I put upon with the Raja Pravartini Vati and as well as the Sukumara Kashaya has been put for a week to take. So that first let her have a cycle, then later on I move upon with the procedure. So even after putting up with the Raja Pravartini Vati and the Kumari Asava medication, she couldn't able to get a proper cycle. Only she has a mild pain, but she didn't have cycle. So later I started directly with the procedure. So procedure I started up to 15 days of procedure where Udvartana followed by Bhasvasveda underwent, the patient underwent the Udvartana as well as the Bhasvasveda. Then later on Snehapana. Snehapana was done with a Phalasarpi, and for this patient, for 4 days she took a Phalasarpi up to 150 ml of Phalasarpi, the Snehapana taken by this patient. So then moving upon again the 1 day followed by Sarvanga Abhyanga followed by Bhasvasveda. Sarvanga Abhyanga commonly we write with the Muchita Terataila, Sarvanga Abhyanga, even followed by Bhasvasveda done. Then on the 11th of October 2020, the Vamana Karma was done. Yes, Vamana Karma procedure was done. Siddhanta was also found in the patient. Then after a week, Samsarjana Karma was also being said for a patient to take what the daily diet has to be taken for 5 days was advised to the patient here. Along with followed by Shamana Aushadhis here. So moving upon with this, Shamana Aushadhis, regularly I'll tell for the patient to take Phalasarpi here. Phalasarpi is the regular medication I'll be telling along with the Rasayanas of Amalaki Rasayana. One Rasayana I'll be telling for the patient to take. One is of Amalaki Rasayana and along with our Phalasarpi, regularly I tell the patient to take. So then moving upon with this, so next is that, so on the November month, I even as the Kramatana Shodhana after Vamana, Virechana was performed to a patient. There on 1st of November only, I advised her to undergo with a Vidvartana. Only for 7 days I advised, because for Vamana only 15 days was done. So why I directly continued with a Virechana for like first Vidvartana followed by Virechana here, because she didn't get, even after Vamana Karma, she didn't get a cycle. She was much worried about that. Why I didn't get a cycle even after getting a Vamana Karma? At least I should get a cycle, right? She was worried about that. Then I said, see, already you are under modern medication for these many years for conception. So more of modern medications would have been having a very bad impact on your hormonal system. So to normalize at least the hormonal system, it takes step by step. So then you will be getting a regularization in the cycle. So thinking that in the concept, so I directly advise the patient to move on with the Udvartana, then followed by Bashvasveda. Again, the Snehapana is taken for 4 days, that too with the Phalasarpi. It has been taken Snehapana. Then again Sarvanga Abhyanga with Muchita Tilakaila, then followed by Virechana Karma. Virechana Karma which was done with the Trivrit Lehe of 75 grams. The Virechana Karma was done. Then again for 7 days, it was followed by some Samsarjana Karma. So after Vamana and after Virechana. So in between of Vamana and the Virechana, like when she has a 1 to 2 weeks of period, I had been advised for Phalasarpi to take regularly, and also for the Amalaki Rasayana to take. One of the Rasayana I'll be putting along with the Panajar. So then when she got a period, then she got a period in the November month 19th, 2020. That too after completion of Virechana Karma on 15th of November, when she started up with her Samsarjana Karma, that is on 16th of November, then on 3rd day itself of Samsarjana Karma, that 19th she got her cycle. The patient was so happy that after continuous treatment, she could have a proper cycle. She feel very lightweight also. Her weight was also reduced, and she was, and both mentally as well as so physically, she was good enough. She can do all kind of work, and she was so enthusiastic that now so after these many of treatment, I got a cycle, that too without taking any medications to induce cycle. So in the modern hospitals and all, in allopathic hospitals, she used to take medicines for 21 days, then she used to get a cycle. But here only after the Shodhana, without taking any inducing for kind of menstruations, she got a cycle. So she was so happy. For 4 days, the complete cycle was there, and even without not too much of pain, only the mild lower abdomen pain lasting for 1 day was the patient information given by the patient. So then what happened? So then the next treatment I wanted to follow was the Basti line of management. But the patient, after getting the cycle, she was so much curious that she wanted to go for scanning immediately. So she took a scanning also. Then she rushed to an OPD telling that, ma'am, I could able to see one dominant follicle where it has been showing in a scanning report. It shows the dominant follicle of 20 into 17 mm. It is so good dominant follicle. She has been given a history telling that till now I have not seen that kind of good dominant follicle. Only I seen up to a 15 or the 16 mm. Later on it showed a non-significant in the dominant follicle. This is what I have been observed here. So then she told that, ma'am, almost I have been waited for more than 2 months whether we can try for a pregnancy. So by looking into a report, I said the patient that yes, you can try for a pregnancy. You can try this month. Already 2 Shodhanas have been underway. So even it has been put upon with a Phalasarpi for complete 2 months. yes, you move upon with the trying for a pregnancy. So later on in the month, that is within 15 days of period, that is from 1912 when she got a cycle, and around so in the dominant follicle it is of 20 into 17 mm. So when she tried for a pregnancy, and then the next month when I took a scanning, right, it showed a gravid uterus, and the UPT test shows positive. So in the year of 2021, she delivered a healthy female baby. So this is regarding the complete treatment protocol of the case 1. So these are the investigations of an patient. So I think you might look into the reports here. So in 2019, she had got into a follicular study, that is the TVS scan, where it doesn't show any significant growth at all. It just shows where in right ovary it's only attending to 9 mm, and in the left ovary there is no dominant only. That it is on 16th day of cycle. This is one way where we need to note down. That is on even after the 16th day of her menstrual cycle, there was no any dominant follicle, even after taking her allopathic line of management. Even in the month of June, that is in 2019, even still there is no dominant follicle, but only there was a good improvement in the endometrium thickness. See, all these investigations are before treatment, before I start the treatment. So this was her investigations. And even when you look into her USG abdomen and pelvis, right, there it shows a clear cut of polycystic ovarian response for SLAC syndrome. And along with that, there is also an bilateral mild hydronephrosis that is been related to her urinary system. Recurrent, as she said, there is a recurrent urinary tract infections was there. This was the report of her USG abdomen scan report. It was taken in 19th June 2018. So this is the report of 2018, and these follicular reports are of 2019. So, and these are also the further scanning reports of before treatment. So now this is after treatment. So once after undergoing the shodhanas of Vamana, then the Vireshana, and even with the oral medications for 2 months. So she had been having with a good dominant healthy follicle, and her UPT test came positive, and even she had a gravid uterus, and she delivered in the year of 2021. So this is regarding the complete treatment protocol as well as the history of the case 1. So now let me move on with the case 2. So here is the case 2. So this is the patient when she approached me in the year of 2023. So 2 years back, she approached me. Actually, she approached me a bit earlier, and almost in the August or the September month, she has been approached. She also having the same complaints of irregular cycle, not having a proper cycle. If cycle also happens, it will be for longer duration, that is lasting for 15 days or even for the more than 15 days. It is the complaints. So what I did, so I didn't put for this patient, I didn't put any kind of inducing menstruation. Like in first place, I put for the Rajapravati and Kumari Asava to induce her menstruation. But for in this case, I started directly up with an Udvartana line of management, so that even I counseled her. Even Sattva Avajaya Chikitsa was also done to the patient, telling that because she was the very young age, just 25 years old, she had a clear-cut history herself. She was telling that I am the case of PCOD, and I am the case of gaining weight, and also I am the complaints of having the facial hairs also. And she also had a very good complaint telling that only after having doing proper Surya Namaskara or the Yoga Pranayama, I used to get a proper cycle. If I discontinue with Surya Namaskara or the Yoga Asanas, then I may even skip the cycles in that month. This was the complete history given by a case 2. So here, so I have started with the Udvartana in the month of October 2023. Almost 10 days, the treatment, 10 to 15 days of treatment I have given only with the Udvartana as a Vipana Pachana I have advised. So then moving upon with, this is the patient what I see. See, all the other cases, they have only drunk the Snehapana only for 3 or 4 days. Maximum up to 4 days they have drunk. But this is the only case I have seen. She has been ready to even drink for even 6 days, even 7 days also. But I have been only limited with the Sneha Siddhi Lakshanas. So with the Sneha Siddhi Lakshanas, she could get on the 5th day of Snehapana. So once when she got us with the started up with the Snehapana for 5 days. So after completion of the 5 days, I have even advised her to go for Sarvanga Abhyangal, then Vamana Karma. Prior to that, she got a cycle. This is one thing, and she was confused whether to I go for Sarvanga Abhyanga or I have to discontinue. Then again, I have to start up with again doing the Snehapana. This was her confusion, the patient. Already for 5 days, she has taken Snehapana. Then again, I need to take. This was her confusion in the mind. So then again, I counseled her, telling that you have got a cycle, it's well and good. You completed with this, you first complete the cycle gets over, then we plan what to do next. So again, when she come for a next follow-up case, then I put upon with 5 days of like Deepana Pachana Dravyas, like Chitragadivati, Agnitundivati, I have been prescribed for her. She took a medicine. Then again, I advised her in the month of November, even she took 5 days, even in the November month, for Snehapana with Phalasarthi. Again, it is her bad luck. What happened? See, these many months she didn't get a proper cycle. But once she started drinking the Sneha, that is the Snehapana, when she started doing, after completion of Snehapana only, she used to get a cycle. This was her the bad luck. Again, after Snehapana, she got a cycle. But still, again, I counseled the patient, telling that, okay, nothing to worry. You plan Shodhana of Vamana Karma later on. Now you move on with a Basti line of treatment. So here what I did, here I advised her for Basti, Matra Basti, along with the Uttara Basti also being advised with a Phalasarthi here. So then moving upon with this, along with this Uttara Basti and the Matra Basti here, I have advised the oral medication of Sri Vyadihara Rasa and Pushpadanva Rasa along with the Phalasarthi. Here, Sri Vyadihara Rasa morning and night I have given after the food today, and Pushpadanva Rasa even for morning and night after food I have advised, and even the Phalasarthi with 1 glass of milk for complete 1 month till it has been completed with the Uttara Basti and Matra Basti is being advised here. So then again, after this Matra Basti, Uttara Basti, I have been advised her to check once regarding the follicular report. That is follicular study, it has been sent. Here in this case, she is a complete typical feature of PCOS case where she got her follicle rupture. That is the dominant follicle was seen in 22nd day of her menstrual cycle. This is what I said in a previous slide. As the picture I showed regarding the ovulation, telling that it's not only on the exact day of 14th or the 16th day that the ovulation has to occur, but in the cases of pathology related to ovulation, that is related to with special reference to an ovulation with the infertility, even the ovulation even can occur after the 16th or the 18th day of menstrual cycle. So this is what her follicular study on 20th day of menstrual cycle, where she could able to see the dominant follicle and getting ruptured. So then moving upon with the, see when this time, that is the 22nd day of menstrual cycle, once the follicle got ruptured, I have told the patient to try naturally. You go for trying for naturally to have a conception. They have tried even in that month also, but she couldn't able to conceive in that cycle. This was her, this I can tell it as an drawback, or can also take help her bad luck also, where even after taking this many of medications and even after the Basti line of management, after this Basti line of management, when she had in 20 day of menstrual cycle, the ruptured follicle, but she couldn't able to conceive. So then again, the patient follow-up, she did a proper follow-up to the OPD. So then again, I planned with the Uttara Basti in the March month. Then again, it is after Uttara Basti, then the patient mind was prepared. She was prepared, feeling that, okay, with the line of these managements after Snehapana, discontinuation, getting cycle, then Uttara Basti, then the Matra Basti, I could able to get a follicle at least in the day of 22nd. So let me move on with the one Shodhana of Vamana. So then her mindset was completely prepared. Okay, I'll move on with the Vamana Karma here. So then moving upon here, Snehapana, then this is her third time. This is a patient where I'm seeing the 2 times of her Snehapana, she got a cycles, completion of her Snehapana. Then the third time again I planned for Snehapana, same with the Phalasarthi. Thank God here to tell that here only for 3 days she could able to take a Snehapana. Because already previously 2 Snehapanas for 5 days she has taken. So she was worried whether again I make her to drink for 5 days, but she only limited for 3 days, telling that enough of drinking Snehapana for 2 months. So then moving upon with the next, finally it was on April 2024, she completed a her with Vamana Karma. Even the Pitanta was also seen in the patient, and also completely even follow the Samsarjana Karma for 7 days. Whatever the advices and whatever the procedure was done to the patient, she was confident about the Ayurvedic line of management, and she was also improving in her health condition also simultaneously. So again, this is her third Uttarabasti. So consecutive cycles she had been underwent with the Uttarabasti line of management with the philosophy. So here you could able to see that on 13th of May. So follicular study done on alternate days, but still in this time in the May month she couldn't able to see the significant one. So only in the February month where she could able to see the significant follicle, but again in the May month there was no significant at all. So then once again I checked the prolactin level, it revealed normal. Her prolactin level was normal here. So here in the right side where you can see a small information where in the complete June month where I have been advised her for Matra Basti with a philosophy. So once she got a report, again looking into a same factor, that is of no significant growth of follicle. So when I move on with the Matra Basti with philosophy, that is for the complete month to take. This was the management what I been followed, especially in the case of case 2 in June month. So this is the very important thing where I wanted to tell. So after the line of managements, so in the July month also, what happened here, she got a cycle. So as complete June month when I advised her to go for Matra Basti, then in the July month she got a cycle, and the cycle was good enough. The 5 days of flow was there. This was the better cycle she could able to get after complete Shodhana and after the Matra Basti for complete month. Then on the same month, that is on July month, when she completed with her cycles, then she went for an 14th day of cycle, the follicle report on the alternate, again it is of no significant growth. This is the very important thing to note down, because as the patient was looking into the reports telling that I am not able to get a good follicle, I am not able to get a good follicle. This was her stress in the patient. This was the tension, this was the anxious the patient was having every follow-up checkup. She was the only mindset telling that these many medications I'm taking, this many best line of treatment, but still why the growth of the follicle not taking? This was. So again in the August month, she missed a period. So when I sent for UPT, it was negative. There was no any positivity sign of conception. So the September month, she got a cycle. So with the cycle, with the LMP of 11th September 2024, again the flow was good enough. The 5 days of flow was there. So then I planned for Uttarabasti consecutive cycle with the Phalasarthi, again with the Matra Basti till the ovulation period. That is 14th, 15th, 16th of September, followed by her cycle, where the Uttarabasti done for 3 days, then followed by Matra Basti even with the Phalasarthi was followed for this patient. So on 28th day of the cycle, where we could able to see, that is on 28th September, that is exactly on a 16th day. Yes, of course, on the 16th day of her menstrual cycle in the September month, she could able to find a very good follicle of 18 into 15 mm size. So that much very good dominant follicle she could able to see, and she was so confident enough that, oh yes, in this cycle I'll be able to conceive, because these many cycles where I am not having proper flow, as well as there was no any significant growth in the follicle like past 2 months. So this was the cycle I got the 5 days of flow with the dominant follicle is there. So we try for pregnancy. So here what happened, So they has to try. I said I'm going to naturally try for pregnancy, but the couples later on they decided, as they had an family doctor telling that why can't you go for IUI? That family doctor just given just telling them why you are trying these many months, even with having a cycle or without cycle or even not with a significant follicle. Now we have gotten follicle growth here, try with an IUI procedure. So then they again approached me telling that, ma'am, you go with this procedure. Along with that, we do try these many months. Then I educated them, telling them, yes, we can go with even with the IUI procedure. It's not so big deal to go with an IUI procedure. We can do, but the thing is that there is also a few of complications will be there. And it's not a thing that only with the first sitting of IUI you can conceive. There are the very chances are less to conceive even with the one first sitting of an IUI procedure. So by educating all these things, giving a knowledge regarding what the IUI, what its possibility of conception from the IUI, what are the advantages and the disadvantages of an IUI, all these were explained to the couple. Then taking a consent from a couple, then I move on with an IUI procedure. So with all the grace of all our procedures of Vamana, as well as with the Basti line of management, Uttara Basti and the Matra Basti, that she could able even with the conceive after doing a procedure of IUI. So in the next month, she had on the 17th of November 2024. Yes, 17th of November 2024. So her UPT test was positive, and her early pregnancy scan, it revealed a single live intrauterine gestation of 6 weeks. It was being revealed. So this was the report of this second case, and she was under my regular ANC checkup. Regularly ANC she has coming for complete so 1 year, and the last month in the June month she has been delivered. In the June month, the patient delivered a male baby. So the male baby of 3.2 kg of male baby she delivered in our hospital in this year in the month of June. So these are the reports of case 2. So all these reports were done prior to the treatment. So it is related to her complete blood count. Even her RBC count was also done, and even her thyroid test, even her AMH level was also done, and all the serology tests were also being done, and especially regarding the ultrasonography, all the previous reports were also I have gone through all the previous reports prior to the line of treatment. So, and this is the report where I wanted to tell you that it is after the treatment, that is where you could able to see, find the 18 to 15 mm. It was one dominant follicle where she could able to get on the day of 16th day, and her endometrium thickness was 11.1 mm. It was her endometrium thickness. It is good enough to have a good implantation once the egg gets fertilized. So this is what I have been noted once after this many months of treatment, that she could achieve a very healthy follicle. What I wanted to explain here is that even though repeatedly when she is not getting a good dominant follicle or not having a increase in significant growth in the follicle, she was so upset and stressed, but still she believed in a Ayurvedic line of management, and still she had a very good confidence, telling that no, I continue the treatment, and she had a very confident telling that yeah, whatever advices you are giving, not only with the medications or not only with the Shodhana line of management, even she is following prana, yoga, yama, all the things along with the patyas, she had a self-confidence, and she believed in the line of Ayurvedic management as well as herself. And when I took a follicular report, it showed an 18 to 15 mm of dominant follicle with a very good endometrium thickness of 11.1 mm. Among these 4 cases, I have seen a very good thickness in this patient, that is in case 2. So when she brought up this report, I had another second thought, telling that yes, okay, the thickness is 11.1 mm and the dominant follicle is there. Yes, of course, the patient will conceive. Even I also had a little bit of confidence in myself, yes, this patient will conceive, as we are planning for the procedure of IUI, as well as, yes, of course, she conceived. She conceived in the the November month. Her UPT, her UPT test came positive, and I immediately sent her for early intrauterine gestation. It showed a gestation weeks of 5 weeks, where there was a little bit confusion. Again, there was no fetal pulse seen. So again, the patient got bit tensed. She started again asking a number of questions to me. Ma'am, I have conceived, but the report is no fetal pole. What to do? Should I wait or should I not wait? This was her a very worries about this, no fetal pole at all. So then I counseled both couples I counseled, telling them, don't worry about this report. You have conceived. That is the one thing. That is the very important thing. You have conceived. So we will wait for 2 more weeks. 2 more weeks. It's very important. We will wait. So I advised her the healthy pathas to follow, and I advised her, you take a complete bed rest. Don't do any kind of work. And follow the one medication. I said her to follow the proper one medication, that is the Palasarpi. Palasarpi you are already taking as a Snehapana, up to 3 consecutive consecutive cycles only have taken 3 Snehapanas. After taking Snehapana, you are taking the cycle. Then after last Snehapana, you followed with the Vamana procedure. So believe in Ayurveda, believe in the line of management. You can see this is what the counseling I gave to a patient, where she followed the same thing. She followed the patya, the complete bed rest. Again, after the 2 weeks, when I took her for a scanning, it showed a single live intrauterine gestation was there up to the 6 or 7 weeks of gestation. Regular ANC patient, still I know the patient very well, and she delivered in our hospital, and it was a male baby, 2.2 baby weight. So now let me move on with the case. So here it is the couple. So let me start up with when they visited to our OPD. This in the year of 2025 January. That is this year only. It's the starting of the year. That is in January month they visited to our OPD. So here, the starting of the days, I started up with the procedure, same thing. That is the Dipna Pachana with the Vidvartana, Snehapana, same Palasarpi have been followed. The complete Jan month, I planned for Udvartana, followed by Snehapana, Sarvangabhyanga, Vamana Karma, and the Samsarjana Karma. It has been a complete 1 month. It has been dedicated to the patient. Why I complete 1 month I gave for the patient only for the Vamana procedure here. Starting, she had completed with her cycle. She has said that she completed with her cycle. So I move on with the Vamana procedure here. And she also had multiple cyst, ovarian cyst, multiple ovarian septate cyst. She had a typical feature of septate ovarian cyst. She had given a report on the first day of her visit. So as she completed her cycle, so I started directly with the procedure and followed by Vamana Karma here. So then her LMP, that is, she got cycle in the February month. After complete process of Vamana procedure in the Jan month, and 23rd of Feb 2025 this year, in the February month, 23rd, the menstrual flow was good enough. She was having 5 days of flow. So then moving on with the next, what I followed here. So here in this case, after that, I followed with the Matra Basti with Palasarpi, then followed by Uttara Basti. See, Uttara Basti here for 3 consecutive cycles, followed by Matra Basti I have given. So even in the April month, I have followed the Uttara Basti, even in the May month, and even in the June month, I have been followed the Uttara Basti. And it is a very short duration of period, where in the 2 cycles where I sent on February month follicular report, didn't show any significant growth in the follicle, as well as in the May month there was no significant growth in the follicle. So in the 2 cycles there was no follicle growth, but once after the completion of 3 consecutive Uttara Bastis, in the June month she could able to see a very good dominant follicle. That is, when she got a cycle in the month of in the month of June, that is on 19th June 2025, she got a cycle. So then I sent her follicular study on the 15th day. So it comes around 7th month, that is July month. That is this month only I have sent. that is on 15th day of cycle, it was one dominant follicle was there. So in the next slide, I'll show all her reports. It is so, her reports is so enough to understand that it doesn't show any dominant follicle at all, even at least 1 centimeter or even with 2 or even with 6 or 7 centimeters, 7 meters, millimeter, it is. Only with the July month that I could able to see only the one dominant follicle was present. With the endometrium thickness was 7 mm. Good enough to tell at least in the 15th day of cycle she is having a EP that is 7 mm. So here what I plan, I counsel them, I tell them, see, you are coming up for a treatment for 6 months and you are having a multiple issues of irregular cycles along with a separate ovarian cyst is present. So with all these things, even with the issue of no dominant follicle past 2 months, better you try it naturally also. Prior to that, let me go under with the IVF procedure, let me see with that. So it has been helpful for you as an immediately to consider. As the patient had an history married life of 7 years, and she's the age of 31 years and a married life of 7 years, and the husband age was 39 years. So they have an history of age, husband 39 years and the wife 31 years and married life of 7 years. So I just educated them. So these many complications are there with the age factors as well as your cycles, as well as your multiple cysts or the septic cyst, ovarian cyst is there. And still after these many line of management, you are able to get at least a single dominant follicle. You try with this procedure, and even with the alternate days, you can try naturally. This was the advices given by me to the couples. Yes, of course, they agreed to all these things. They followed the pathas, and also with this line of managements, they have been followed. So I am waiting for the result. My main intention is that to have a dominant follicle, that to have a very good grafting follicle here. So I got the follicle here. So as well as I just told them to try for pregnancy, I'm so waiting for the result. So then let me move on with the investigations here. So here you can see the three ongoing treatment investigations. So prior to one investigation that showed an ovarian cyst, where here ongoing itself it is having an ovarian cyst along with a septate cyst, and here you can able to see even on the 15th day of her menstrual cycle, she was not having follicle at all. There was no follicle growth or there was no any follicle. There was absence of follicle here, but her endometrium thickness was good enough. It was 8 mm. Yes, of course, when she get a cycle, she has a good flow of 4 to 5 days. So amount was also good, and as well as regarding the duration was also good enough. Endometrium thickness was improving, but wherein the follicle growth development was not significant. It was seen in the month of Feb. The same thing when even after the consecutive cycles of Uttarabasti treatment. Again in the May month when it was sent, there was no follicle at all. So then I decided, okay, you stop looking into the follicular growth. Let me continue with the treatment for further consecutive cycles. Later on, we will see. So later on, when we look into the follicle growth, there was one dominant was there. So the couples was so very convinced with the line of management. So this is the one thing what I wanted to tell. So patient taking the treatment is the one side, that is the primitive one. The secondary thing is that they have to get convinced. That is very important, because when they go for modern line of management, whatever the medicines they are giving, they do take regularly, and they don't even ask them whether the side effects are there. But these couples were the one who are asking me that now and then these many treatment I am undergoing, where it will be leading to some other complications. This is what the question from their side. Then I was telling whatever I am doing the procedure is all the procedure is being related to the Shodhana Karma, and where it is mainly of like Vata Dushti Hara it is, and Vatanulomana it will be there, and it also helps in having Agni Deepana also it will be there, and Ama Pachana will be there, Agni Deepana and Ama Pachana, and the Shota Avaro, whatever the Shota Dushti is there, that will be clearing the Shota Dushti, and more of Artava Shota Dushti here it is there, so it clears the Artava Shota Dushti, and it helps in having a to get a cycle properly and to have an proper ovulation. So it is on the 15th day where I could see the dominant follicle. While in the first report, you can see that even after the 19th day, only the endometrial thickness was good enough, but there was no any follicle formed. But after the line of management, after the consecutive cycles of Matra Basti and Dautra Basti, I could see the dominant follicle could be seen in the ongoing treatment. So now let me move on with the last case, that is the case 4. So here is the case 4. So here what I wanted to tell is that here's the couple, both husband and wife were too anxious. Not only the wife here, even the husband was also too anxious. He is the first one to approach and tell that already I am crossing the age 40 years and she is 31-year-old. We don't have much hope that whether we conceive, whether my wife will conceive or not. This was the first complaint what I heard from the husband. My age is 40 and my wife's age is 31, and we are trying since our married life, and the married life were almost 4.5 years of married life. And the very important thing I wanted to tell regarding this is that her cycles were irregular since menarche. This was most concerned complaint of a couple. Cycles were irregular since menarche, and before coming to our hospital, they are rushed into other hospitals, allopathic hospital, and whenever they take a medications, they tell to the patient that your condition of PCOD typical feature is that, and your ovulation will be irregular. We can't assess it properly when the ovulation happens. So this is why the complete history given by couples to me. One regarding the worries about age, that one is 40 and another wife is 31 years. And the very important thing, since menarche cycles are not regular, and already they have visited a number of other hospitals, allopathic hospital. They have said that already she is suffering with this cycle and also with the ovarian cyst, and we can't even assess a proper ovulation period when it happens. This is what that clear cut picture of history of couple. This was the thing, and in the complete history, they said that she has multiple issues of an uterine cavity. That is related to her polyp was also there. I'll show you the investigations in a further slides about this patient. She's having n number of investigations and n number of medications she has been underwent this patient. Okay, so the one thing what I wanted to tell is that her history tells regarding the laparoscopic ovarian trimming. Along with that, she also underwent the polypectomy, endometrial polypectomy was also there. That surgery was also being underwent. So the why she underwent this ovarian trimming as well as the endometrial polyp, that too 1 year back in some other hospital, allopathic hospital, she has been underwent. So in the mindset where they have been educated that, so you first undergo with the laparoscopic surgery of all these things so that it will have a good development of a follicle when you can able to conceive. So taking this knowledge, so she had been underwent with the laparoscopic ovarian trimming along with the endometrial polypectomy she underwent. So after 1 year, after laparoscopic, she had a cycle regularly for 3-4 months. That's it. Prior to that, there was no regularization of cycle, menstrual cycle. After laparoscopic, 3 to 4 months, she had got a regular cycle. Again, after 3 to 4 months, again she developed with a irregularity in her menstrual cycle. This was her chief complaints, telling that after followed by laparoscopic surgery, 3 to 4 months she had a cycle. After that, her cycles became irregular. Don't know when she gets a cycle. If the cycle will be there, it will only be lasting for 3 days. That's it. This is what her complaints, lasting only for 3 days or the 4 days. If happens also, it would happen for a week. This was the complaint of the patient here. So here, what I did is that, so when I gone through the history part of the patient, so starting of the month, so I planned directly for the procedure of Vipanapasana, that is of Vidvartana, then followed by Snehana. Again, see, all of my patients are put upon with the Phalasarthi only. So the Phalasarthi, as the Phalashruti tells regarding the Garbha Prada, that is, it helps in the conception. So where this data I have been followed for all the cases. So here also the Vamana Karma only have been followed by the Samsajana Karma. So starting up in the December 22nd up to the Jan 1st, I have been starting following the procedures of Vamana Karma. Then in the January up to 7 days, it has been of Samsajana Karma has been followed, then followed by Shamana Aushadhi. See here, what I wanted to discuss is that so January month and the February month, only the Shamana Aushadhas have been given and she didn't get on cycle. That is very important. I'll discuss it what the Shamana Aushadhas have been given to this patient. Because she is irregular, she is a minority where even she is having a mindset that when she get a ovulation, when she get a cycle. This is what the main worries of a couple here. So again here I have been telling them to take complete the Gita as well as the Avalaki Rasayan they have been said and along with the Chitrakadivati also been mentioned for this patient here complete month. But still January and the February month she couldn't be able to get a proper cycle. So then moving upon with the March. And again in January and February month I have been called them for a follow-up, but they missed a follow-up because of their personal inconvenience or the personal work. They couldn't able to do a follow-up of January and February month, but still they could able to take a Shamana Aushadhas regularly. Then after then I started with a yes, then when they gave a follow-up of in the month of March 2025, so then I started up with the Niruha Basti as well as followed by the Uttara Basti, Yoga Basti as well as the Uttara Basti was also being given. And along with that, after that again in the March month, Shamana Aushadhis were given. But when she got a cycle in the March month, right, then again I sent her for follicular study, but it doesn't show any significant growth. So there was no any significant growth over there. But then I move on with the next cycle that is on April month. Okay, so then April month, then again she got a cycle. It was in the 19th April 2025. Here the flow was 4 days. Usually the patient was telling that only the flow will be there for 2 to 3 days. Up to 3 days it will be there, maximum up to 3 days. But here as per the patient information, she said that it will be lasting for, it was there for 4 days. It was a good cycle. The flow was good enough. She was not having even the pain abdomen. This was the patient history given on the April month. So then April month again I followed with a second consecutive cycle of Uttara Basti, then followed by Matra Basti was also done for 10 days. So complete consecutive 2 cycles have done with the Uttara as well as the Matra Basti here. So then moving upon with the May month. So here May month is the one where I was planning for another line of management where the Kalabasi I was planning for this patient. But the May month she didn't get a cycle. So then what I did, then I again sent her for an yes, scan. Yes, scanning was sent, but that report again didn't show any growth at all. So this is what happening in this patient. So where in December month when I been started out with the treatment completed in the January month, but no cycles for again Jan and Feb month. But she started regulating her cycle on the March month as well as in the April month. May month it didn't show any significant growth at all. So then it is to tell that Sukumara Kashaya, Phalasarpi and Rajapravartinivati only for 10 days I have given for a patient. Only for the 10 days I have been given for a patient to induce the cycle there when I didn't see any vermil follicle. So for the inducing this I given medicine, and after that I had a plan of going for Kalabasti there. So prior to that, so again after 10 days, that to 10 days only she had taken, but only mild pain abdomen she was having, but nothing else. Only the pain she could able to have, cramps she could able to see. So you were able to feel the cramps or the abdominal pain, but no the flow was there. So then again the next follow of the patient came on 23rd of June, telling that no, again she missed the cycle. But I had an then I asked the patient, I asked the couple also, so whether you tried last month, so whether any history of vital activity. As May month there was no dominant follicle, I have been induced for this cycle, so that I am planning for a bust line of management, because this is a typical case where I could feel So I could understand the case where there was no dominant follicle as well as there was no any endometrial thickness at all. This is the particular case that I could see no ovarian follicle also and the endometrial thickness. So on the June month they came on the 23rd of June month. So again she said that only the pain is there but no cycle. So what to do? So then I said that whether last month have you tried? This was her because she's an a typical case of PCOS, complete PCOS of typical case where already she is having a mindset that her ovulation can be on any day. So when I asked her history of coital activity, she said that yes, the last month that was in the yes, in the May month there was an history of coital activity. So then when it is being missed more than a 1.5 months, the cycle was not there. So I sent immediately for an ultrasonography of her pelvis. So ultrasonography of her pelvis when I sent, it is being revealed telling that it is having a gestational weeks of 5 weeks. So here, so in the what way manner I need to understand or to relay on this report is that so the exact 1 month it is being taken for the nourishment of an ovary, the nourishment of an follicle, and even to have a good endometrial thickness over here. So exact 1 month that is up to the 19th.
Time, madam. Time.
Yes, sir, yes, sir, yes, sir. So this is regarding the ovulation as the exact on the 19th day of May she was having and the conception occurred and the patient conceived. So these are the reports of the patient. These are the very prior to the treatment. So then this is also the prior to the treatment. So many investigations are there. You can go through this. I'll share the PPT. So this is the ongoing treatment. So you can observe no dominant follicle at all. This is the one thing. And there later on when I sent for the USG scan, it shows the gravid uterus with a gestational weeks of 6 weeks with a single leg intrauterine gestation. So let me move on with the outcome. So outcome here is that after Shamana and the Shodhana Chikitsa as well as with the Satya Vajaya Chikitsa, that is after counseling and after prana, like advising of pranayama, yoga, asanas and the Shamana and Shodhana Aushadhis that will help in relieving the anxiety, stress disorders and regularization of cycle. And in the same cycle, they can be able to get a dominant follicle. And apart from 4 of these patients, 2 patients conceived and 1 delivered female baby, other patient delivered the male baby, and another one and the regular ANC patient. Still, she is coming. Now she is of 8 weeks of gestation, 2 months, and she is and another patient. The result is aborted. This is related to the outcome of this case. So let me move on with the conclusion here. I wanted to tell one line of conclusion. That is, Shastram Jyotihi Prakashartham Darshanam Buddhiratmanah Tabhyam Dishat Suyuktabhyam Chikitsa Na Aparadhyati. See, why I have put the conclusion regarding this reference? See, when we go through the Shastra, that is the Samhita, that is, it is giving a light upon the treatment. So the Samhitas, when we understand, and Prakashartha Darshanam, that is when we have a practical knowledge, both theory as well as practical knowledge will help you to get a Chikitsa done properly. That is the Phala. Phala will be good enough to achieve. So both the Shastra Jnana as well as the Darshana Jnana, that is of both theoretical knowledge as well as the practical knowledge will help a consultant, about a physician to treat the disorder properly and to get the result, appropriate result. So these are the references. Thank you.
Excellent. Excellent. No doubt excellent. Excellent flow and excellent narration, excellent presentation, everything excellent. You have communicated your practical experience. That is a great issue, no doubt. So I would like to invite, though we are late, I would like to welcome Parul Joshi Madam. She was also head of the department PTSR. Now, but for comments of this webinar, I would like to request Dr. Gayatri Bhatt Madam, who is Gurudevi of Dr. Soumya
Yes, sir.
So, Dr. Gayatri Bhatt, madam.
Yes, good
Welcome,
evening,
madam.
sir.
Welcome. Welcome,
Thank you
welcome,
so much,
welcome.
सर. आप इतना अच्छा काम कर रहे हैं. इस इसके लिए हम एक्चुअली हम आपको कंग्रेचुलेट करते हैं. और आप सबको अपॉर्चुनिटी देने का आपका एक ये मन है, हमको अच्छा, बहुत अच्छा लगता है. एंड मुझे भी आपने बहुत सारा अपॉर्चुनिटीज दिया है. उसके बाद जब आपका और कामिनी मैडम का मैसेज आया, मुझे लगा मेरे बच्चों को भी चांसेस मिलना चाहिए.
Definitely,
क्योंकि
definitely. Welcome.
देखिए, ये लोग भी ऐसा काम कर रहे हैं, उसको सभी को पता चले, है ना. यंग माइंड्स, यंग थिंकिंग. And I congratulate Dr. Soumya for good presentations, and it is like inspiration. It will be the inspiration for youngsters. So in future also, I hope many of other my students also doing good work in the field of PTS, sir. I would like to involve them also one by one. I thank Kamini madam and Pavan sir for the love, care, and support, and the trust and belief they are showing in me. Thank you so much.
This platform is yours, madam. We are only facilitator. This is yours. Everything
Yes,
is
thank you.
yours. We are doing our exercise for the society. And
Yes, yes, thank you.
you are our pillars of the society, no doubt.
Thank you,
Pillars
sir.
of Ayurveda in South.
Thank,
Excellent. Excellent, Gayatri madam. What is
thank you,
your
sir.
comment on excellent presentation of Dr. Soumya?
Yeah, Dr. Soumya, she has presented well, and the way she has, in the short duration of her career, she has treated so many cases successfully. I think Dr. Soumya, don't feel bad. I think in some slides, some cases, the dates were mismatching. I think it's my observation, or maybe I may be wrong. Please correct those. Otherwise, okay. And I appreciate giving Matra Basti after completion of Uttara Basti. So that's very nice. And yeah, I hope in future also you will do good, and try to try to analyze the mode of action, how it happens, because young minds, you people should do such research work. And really, it was a very good presentation, Dr. Soumya. Congratulations.
Thank you, Gayatri ji. Thank you very much. And I would like to humbly request all of you that please join as a speaker audience in other webinars also. These are only two webinars, but we are conducting regular webinars on various topics, multidimensional topics. Brain day is coming. So brain day we are celebrating on Sunday. Chess day we are celebrating chess for brain development. We are relating everything with health or Ayush. So chess for brain development on 19th. After your woman wellness webinar, we will be conducting chess webinar, chess for brain development. So every type of student can join. That is not
Okay.
there only PTSR, but you can motivate others also to join
Yes,
this
sir.
and actively participate, because due to your mentorship, guidance, and participation, we have been able to touch 2,550 on this Sunday, coming Sunday. Thank you. Thank you, really. Means otherwise it was not possible for me. Thank you. Thank you, experts. Thank you. Gayatri ji, thank you very much.
Thank you, sir. Thank you. Thank
Our
you.
next webinar is on snake venom. World Snake Day is coming. So we are conducting, and our pillar, Madam Parul Joshi ji of AYUSH Samriddhi, means she is really excellent and versatile on different topics. She was Assistant Director of AYUSH Education in Government of Gujarat, and she was Principal of 4 colleges and Head of the Department PTSR. So she will be speaking on snake venom in next webinar. That is also unique topic everybody should like to know it. Thank you for first webinar. Now I am changing as we are late due to as per our schedule. Thank you very much सौम्या जी.
Yes, sir.
आप
One thing I
जुड़ती
wanted to
रहिएगा.
tell you, sir.
बहुत अच्छा बोली,
Yes, sir.
बहुत अच्छा बोली, एक्सीलेंट बोली.
Yes,
अब